I'm Dr. Steve Teitelbaum, and you're watching the Plastic Surgery Channel.
Welcome to Plastic Surgery News. I'm your host, Lindsay Hall. Thank you for joining us today. In this week's report, we've got information on the safety of fat transfers, a report that reveals how up to 40% of plastic surgeries may be adversely affected, and just how far one woman was willing to go to look like her daughter. All of that coming up. But first, doctors in France can now offer an additional option to those wanting a more youthful look. After several clinical trials involving more than 2,600 participants, the French health agency has now approved Azzalure, a botulinum toxin muscle relaxant used to reduce the appearance of lines between the eyebrows. Approval by French authorities, the product, which is similar to Botox Cosmetic, follows a collective approval of 15 other European countries. Once France's stamp of approval was given, Denmark, the United Kingdom, and Portugal followed suit. Non-invasive treatments such as Azzalure injections represent about 60% of specialist procedures in Europe. A Medical Insight report indicated that the popularity of such non-invasive procedures could grow another 13% over the next 4 years. In other cosmetic surgery news, long, lush lashes are high on the list of beauty must-haves, and now there may be a prescription for them. Pharmaceutical companies often discover other uses for their products when patients report side effects. Such is the case for Bimatoprost, produced by Allergan, which helps lower intraocular pressure in patients with open-angle glaucoma and ocular hypertension. Since 2001, patients using Bimatoprost have experienced longer, thicker lashes. Allergan elected to wait for several years' hard data on patient safety before testing the product for use in eyelash growth. The study included 278 adults and was limited to upper eyelash application only. Dr. Stuart Seif, who participated in the study, expressed concern about Latisse affecting eye pigment by causing lighter irises to darken. However, Carolyn Hove, Vice President of Allergan's Corporate Communications, states that, quote, iris pigmentation was not observed in the Latisse trials. It is only a rare effect that has been observed with Lumigan. She adds that while Lumigan is the same product, it is applied directly into the eye rather than along the lash line. This treatment difference does increase the minimal risk of darkening irises. In December, the FDA approved Latisse for treating eyelash hypertrichosis along the top lash line only. Dr. Seif expressed concern that patients will apply Latisse along their lower lash line to a so-called off-label use that hasn't been tested for efficacy or safety. He says he would like to see further trials looking at the drug's use on the lower lids, long-term use in patients with light irises, and how often the drug must be used each week after the first 2 months to keep new lashes in place. Coming up next, find out how a self-described dowdy redhead transformed herself into her daughter's sister, and learn why herbal supplements could be detrimental to plastic surgery patients. But first, a quick break. We'll be right back. The most important annual event in the world of cosmetic plastic surgery is coming this May to one of Las Vegas's premier resorts. May 2nd through the 7th, the Aesthetic Meeting 2009 is being held at the Mandalay Bay Hotel and Convention Center. Learn and interface with some of the foremost aesthetic plastic surgery educators and innovators from around the world. Attend seminars on cutting-edge topics such as new concepts in facial rejuvenation, enhanced breast surgery techniques, updates on new soft tissue fillers, and the latest on breast implants. Visit the exhibit hall to expand your knowledge and explore the options to improve the quality of patient care. With over 300 commercial exhibits featuring the latest equipment, services, and products available, you're sure to find what you need to enhance your practice. Register today for the Aesthetic Meeting 2009 by visiting www.surgery.org/meeting2009. Beauty and science, it's a winning combination.